Hi everyone, this is Aluchi, and as you may know, or what you may know me from, is that I am a writer, a poet. My debut poetry collection, Tasteful Hypocrisy, is currently available on Amazon.com. But I told myself that at least 1 year or 2 years into this app, I will do some kind of content about my actual 9 to 5 job, which is I am a medical lab scientist. So aside from being a writer and a poet, I am a medical lab scientist. So I wanted to harp on or talk about a pain point that we medical lab scientists that work in the lab experience. And I want to preface this video by saying that at the time of making this video, I was currently in between jobs. So I was waiting for an offer letter and I already quit my previous job at the time of making this video. So, and nothing from this video, I'm not affiliated with anybody, and nothing from this video is taken from my old workplace or my to-be new workplace when I get the job. This tube was gotten from like a local arts and crafts store. The label on it that's sticking to it, these I drew on, and I cut it from this UPS receipt. And what I'm going to use as a label, I cut it from the UPS receipt. So again, nothing from this was gotten from any hospitals. Like, I'm not currently, at the time of shooting this video, affiliated with anybody. So I want to get that out there because I know how these internet streets can be. And also, whenever you're talking about something with healthcare, people can get very it can be heated discussions. And again, I want to preface this again by saying, please follow your hospital policy, follow your organization policy, whatever. Again, I am not working at the same place as you, but in general, as a medical lab scientist, this is something that pisses me off. Well, it doesn't piss me off anymore. It's more like an annoyance, like a fly that I just swat away. You know, when you first start working, I've been working as a medical lab scientist for over 8 years now. When you first start working, you have the Tom Cruise and Jerry Maguire attitude, like everything you want to hop on it and and then you start cooling down and you start choosing your battles. That doesn't mean that you're not still passionate, but you start figuring out that there are other ways to go about things. And one of the ways to go about that is education. So now that I've gotten all those things out of the way, I want to talk about labeling tubes. And I'm going to put some of those BD Vacutainer tubes on the screen so that you can see what I mean by the tubes. But then we're going to use this as a demonstration, right? So these are the BD Vacutainer tubes. And then now let's think of those tubes as this. A lot of these tubes, some of them contain gel at the bottom, some of them don't. Some of them, a couple of them don't have any additives, but a lot of them do have additives. Sometimes it's sodium citrate, sometimes it's just potassium. Yeah, one of them has potassium in it. A lot of them have different kinds of additives that you can see written on the tube. And they also have corresponding caps that are the same as the color that's on that stripe. So whenever you draw, and all this is related to one of the pet peeves. It's a pet peeve of mine, but again, this is just, now it's become more like an annoying fly that you just swat away from me, but it's still a pet peeve and it's still annoying. So when you are a lot of nurses and a lot of people that are trained in phlebotomy are very good at this. So if you're one of those people, please keep scrolling. But if you're not one of those people, and let's say there was a vacancy and you don't really draw blood and you're grandfathered into, drawing blood, or something happened and maybe you don't usually do this and now you're doing this with minimum to no training, please make sure you have like the handbook, the order of draw for your organization. Make sure you look through that before you start drawing blood, and make sure that you feel comfortable drawing these before you start doing it. Now, let's go back to this. Whenever you want to label a tube, you've put the blood in and you want to label a tube. We're going to use this as the fake label that has the name, MRN, date of birth, all that, right? And then you peel off the fake label. A lot of places like it when you write the date, when you scan it, you label at bedside, right? And then you also scan it in the computer. A lot of places like that you write the date, time, and initials on the date, time, and initial spot, especially the blood banks. Now, this is the label and you're going to label this. This is how you label. As much as you want, like, make sure as much as you can, because there are times where you really can't help it. Let's say you have a patient label and then you have the order label and now you have to fight for space. There are times you really can't help it, but when you can help it, make sure that you start labeling, so this, but you start labeling from here, right? So if the cap is changed for any reason, having it here will let me know, okay, this is a blue top tube that this person drew, right? I mean, there are other things that will tell me, but this is one of them. Okay, this is a blue top, in case the caps get changed for any reason. And then when you go to label, don't cover everything up, because if you cover it up, this label, when I now go to peel it, I will now peel, and sometimes I will peel off the patient information and it will just look so weird. So one thing you want to do is, whenever you label, this label is kind of too long, but the labels are cut to make it work. So whenever you label, make sure that at least some part of this spot is open. That way, if you draw like a short draw, I can just look at it and be like, okay, this is a short draw. Because a lot of people do it intentionally to hide their sins, but a lot of people really don't know, right? So just make sure that that part is left open so that I know that it's a short draw. Or I know where because when we spin it and the blood goes to the bottom and the plasma is on top, so I know where the plasma is. So if it's a short draw, if it's something that I can do with a short draw, I know what I'm working with. That way, if it's something that maybe if I put it in the instrument and the instrument is going to suck up everything, I know how to maneuver it so that we can work with what we have for your patient. Another thing is, let's say you have the patient sticker, like their chart sticker, and now you want to label with the order label. If you're going to do that, now make sure you leave at least, don't just take this label and cover everything. Because now you did the patient identification. Us in the lab, when it gets down here, we have to do the patient identification, right? Right. So when I'm going to do it, I'm going to have to now peel everything out. When you could have just, let's say you put the patient label, right? And then you want to now put the order label. You can just, hang on. So let's say this part is where the patient name, the MRN, the birth date is, right? Just take the order label and just put it right here. Hang on. And just put it right here. That way, if the patient information from the chart sticker is here, I can now correspond this to there without having to peel it off. That way it can say, let's say it says Jane Doe, born January 1, 1990, right? And right here it still says Jane Doe, born January 1, 1990. I can just look and be like, okay, this is Jane Doe's sample, without having to go through all the hoopla of peeling everything out. And then another thing is, if you get to a point where you now have to cover everything, another thing you can do is just flag this sticker. Just flag this sticker like this, right? That way, even if you cover it and it gets to the lab, I can just look here and be like, okay, wow, so this is when it was collected, instead of covering everything. It really is helpful, trust me. And then honorable mentions is whenever you collect, sometimes somebody collects like a pink top, right, or a purple top, and they're like, oh my god, I collected the wrong tube, no one is looking. And then they now take the pink top they collected and pour it into the light green top for that we usually use for BMPs or CMPs, right? Well, when it gets to the lab, Big Brother is watching. We will know, because the CMP, one of the things in that CMP or BMP is potassium, right? And what is the additive in that your purple top or that your, purple top or pink top? Potassium is there, right? Now that person's potassium is gonna spike up more than what it actually is, and this can cause wrong patient results. So if you draw it wrong, just toss it, and it will suck to explain to the patient why you have to redraw it and all that. But again, patient safety above everything else, right? So do that. And also that order of draw that they tell you is important, because if you're using like a vacutainer, standard vacutainer, and you're not doing it properly, now you're contaminating tubes. Let's say if you draw one thing that's supposed to be drawn at the end and you draw it in the beginning, that additive that's in that tube can now contaminate those other tubes and make whatever analytes we're measuring higher in those other tubes, higher than it actually is in the patient. So yeah. And another thing is, if something is clotted, let's say we're doing coagulation, and then a sample is, let's say you collected the sample from the syringe, and you collected the sample with a syringe, right? And then you're putting it, squaring it in, putting it in the tubes, and you see a clot, and you remove the clot and square it back in the tube. There are some lab tests that clots don't really, it's not really a big deal for, but it's just a small amount of lab tests. If you do that and it's a coagulation test, I mean, we're checking clotting. If the thing has already clotted and now you're sending it to us, like, what are we going to do with it? And that's when you start seeing really weird results, like the pro time and the PTT, the PT. Things are now, some things are high, some things are low, things are now wonky. And sometimes they imitate, this is when, like, for example, they imitate like certain things, like certain medical conditions, and now doctors are freaking out. So if you see a clot, don't squirt it out. It will show in the lab test. And sometimes I know you think the lab people are calling and disturbing you because, we have an agenda against you. No, we don't have an agenda against you. We actually want things to work well for patient care. That is why we're calling and disturbing you. We really don't have any agenda against you. So yeah, that is it for labeling tubes. It's always nice. I mean, there are times where, especially if it's a pediatric tube, there are times where you have what you have, right? You can do what you do with what you have, right? And also there are times where there's just a lot of labels on there that you really can't help, how it comes out. But when you know better, you do better, right? If it's just a standard case of tube and label, this is how we label it. We make sure that at least a little bit of strip of that line is visible, just in case the cap gets switched. We know what kind of tube it is that you use to draw it. And also, if you're adding another label onto a label, make sure that the top of that label that you're adding a label to is visible. That way we don't have to peel everything out just to confirm that Jane Doe February 5, 1990 is Jane Doe February 5, 1990 from the original label that was on the tube. And of course, make sure you label at bedside. Don't take off cloths and then squirt it into the tubes and go about your business, because it will show in the test and it might lead to a wrong diagnosis. Don't say, oh, I drew the wrong tube, no one is watching, and then you pour the tube into you pour whatever that tube is, let's say a purple top, and then you pour it into the light blue green top and think no one would know. When it comes down into the lab, certain analytes are going to be like the potassium is going to be through the roof, the calcium will probably take a nosedive. Like, there are just certain things that will look really weird and will not correlate, that will make us catch it. But what's even scary is when that happens and it fits in perfectly with a diagnosis, and then it turns out that, you know, it was a contaminated sample or a wrong draw. Another thing is, if you have any medication going, if you have heparin going, you know, make sure you pause it according to your hospital's policy, you know, before you draw something. Like, don't just draw immediately from the line and hope that the results look good. No, they won't, because you have heparin going through that line. Like, all these things are just things that you have to think about. It sucks sometimes that, you know, doctors, nurses can be really busy with a billion things, and it will feel like, oh, the lab is here, you know, harping on something, and you think it's something minute, but it's actually something that will impact patient testing and patient results. I have this story time where sometime before, around the time when I was training, I haven't even quite gotten into this field, there was one case study they had us do where some nursing home lady, you know, that was working, because the nursing homes, some of the nursing homes, not all, some of the nursing homes that are away from, far away from the hospitals that they send their samples to, sometimes they draw it, spin it, you know, remove the plasma or the serum, and then store it or freeze it or whatever before they send it over, right? I guess this CNA or whatever, somebody that just wasn't well trained, was the one that collected the samples. I don't know exactly what happened and the samples got lost or whatever. So this patient, this lady or man, I don't know their gender, this individual decided to replace the plasma or the serum with urine. And then when it came to the lab, of course we caught it, because the bond, the creatinine, the urea was looking crazy. Like the normal concentration that should be in a plasma or in a serum versus the one that should be in a urine. Like, the things were looking crazy, man. And that was how it was caught. So some of these things we can catch, but what becomes scarier is if we veer into that territory that things fit perfectly well and no one catches it. So patient collection is important, patient identification is important, labeling is important, and doing things the way your organization said to do it is definitely important. And once again, this is Oluchi from the Kavi Cauldron. Thank you for coming to this TED Talk. I love you.